And so there's more breaking down of bone than there is building. So you have some accelerated bone loss in menopause, more like 2% bone loss per year as compared to 1% prior to that. And then in your joints, you get this greater level of inflammation, which ultimately plays out in women over 50 having a much greater chance of having arthritis than men over 50, especially in the knees. Because the cartilage gets thinner faster, the lining of the joint is more likely to be more inflamed. And then in shoulders, which is a long time area of interest and research for me, of course, frozen shoulder is almost not exclusively, but very much a disease of women between the age of 40 and 60. And we know that the lining of the shoulder joint has estrogen receptors. We know that estrogen inhibits cells called fibroblasts that thicken and stiffen the capsule of the joint. So we know that at this point, I think it's pretty well accepted that frozen shoulder is also, or adhesive capsulitis is a condition of perimenopause and menopause.